Hey everyone, let's take a look at some skull anatomy here. Figure out what bones we need to know and what structures we should know. First, let's start with the bigger bones that make up the brain case. We've got this big bone on our forehead that forms the upper part of our orbitals, or the upper part of our eye sockets, and that is the frontal bone. We have one frontal bone right here in green. Rotate her to the side here. We can see that we've got a few other bones encasing the brain here. We've got the parietal bone right here, yellow parietal bone. There's two of them, a left and a right. And then this one that forms sort of right around our ear and can form our auditory canal right there. We've got our temporal bone. On the back, we can see the last major skull bone, this orange occipital bone that's got a big hole in the bottom of it for our spinal cord. Working our way around the other side, we can see that occipital bone in orange, yellow parietal bone, purple temporal bone, and we're back to the front here. Now let's go over some of the facial bones that we should know. The biggest and most obvious ones are our big cheekbones in blue here, a right and a left zygomatic bone. This red bone right here forming the upper part of our jaw, that is the maxilla or the maxillary bone. And then our lower jaw is formed with this mandible down here. Zygomatic, maxillary, and mandible. Next up, we can see into the eye socket and see a bunch of the facial bones that we should know. These ones are maybe the hardest ones to learn, but here's the way that I approach them. I start at the tip of the nose right here and then work back, and you can almost find all of the bones, of the facial bones right there. So starting at the tip of the nose right here, we have the nasal bone in white. We've got this red maxillary bone. We can see here this little green bone. That is the lacrimal bone, right where your tear duct would be, that lacrimal bone. The red bone that we can see back here, this is our ethmoid bone. And then forming the back part of our eye socket, we have our sphenoid bone. And you can also see the sphenoid bone from the side right here. It'd be covered by a muscle that slips underneath the zygomatic and temporal bone, but there we can also see the sphenoid bone. We can also see some bones if we look straight through, straight through our nasal opening right here. We can see this red bone, which is the ethmoid bone. And so this big plate that comes down is the perpendicular plate of the ethmoid bone. We've got this little blue bone right here, kind of hard to see unless we can see right inside the nose, and that's the inferior nasal concha, and there's two of those. And then this orange bone right here, we can see as the vomer bone, and the vomer bone is this beautiful fin that kind of fits straight up into the ethmoid bone above it. One more bone that is best seen if we can look from an inferior view here. We can see these two paired bones right here, and these are our palatine or palatine bones right there. So those are easily seen from an inferior view if we look at like the inside of the mouth. All right, good luck studying, and I'll be back with more videos. All right, let's go over some structures on the skull that we should know. I've got the mandible removed, that's a little bit easier to work with. Let's go over the sutures, which are the joints between these skull bones. Kind of on the top part of the head, forming the joint between the frontal and parietal bone, is this coronal suture, coronal suture. And corona means crown, so it's kind of like where a crown might sit, right on your skull. We can see this joint between the parietal and temporal bone, and this is the squamous suture, and this area of the skull is called the squamous, kind of right by your temple. So the squamous suture separates the temporal and parietal bones. From the back, we can see where the two parietal bones, left and right parietal bones, meet, and right down here is our sagittal suture, and this one runs right down the sagittal plane, straight down the middle. It would cut this skull into a right and a left half. Here, we can see the suture between the occipital bone and the two parietal bones, and then this suture right here is called the lambdoid suture. The lambdoid suture can be seen right from the back there. A couple other structures that we should cover. These big eye sockets, these are our orbitals. Got two orbitals where our eyes would fit and a bunch of bones that make up this whole orbital there. If we look down inside of the orbital, we can see this optic canal right there. The optic canal where that optic nerve would run through. Keep in mind that it's not this big hole right here. That's that superior sphenoid fissure right there. But we're looking at the smaller hole that it looks like a small little nerve would run through it. There was that optic canal. While we're up at the front here, on the mandible, we have a few little holes. We've got our mental foramen on the front of our mandible right here. And if we look at the inside part of this mandible, then we can see this mandibular foramen right there. So two different foramen on our mandible, the mandibular foramen from the inside, and then the mental foramen on the outside. Keep in mind that there's two of each of one of these on the left and the right sides. We can see our cheekbone right here, and we can see that it forms this beautiful arch between the temporal and zygomatic bone. We would call that the zygomatic arch, the zygomatic arch. And this isn't on our exam, but you'll see this written in diagrams sometime. This little structure right here that forms this part of the zygomatic arch is the zygomatic process of the temporal bone. And then this little part of the arch is the temporal process of this zygomatic bone. So sometimes it's confusing if you point to this spot right here and say that that's the zygomatic process. You might be thinking, wait a minute, this is the temporal bone, but it's the zygomatic process of the temporal bone. This is going to be the temporal process of the zygomatic bone. Again, I'm just going to ask us to learn that this structure right here that forms this little bridge is the zygomatic arch. Also around this side here, we can see that we have, on the side of our skull, we've got this huge process right here. And it's a big point of attachment for a muscle to connect right here and help rotate and turn the head. And this is the mastoid process, the mastoid process. You can see our ear canal right there, the external acoustic meatus. From the bottom, we can see a couple more structures here. The biggest one is this hole right here, the magnum foramen. And this goes through this occipital bone, and it's where our spinal cord can pass through. And on either side of this magnum foramen right here, we've got our rounded surface structures. And this occipital bone, it articulates with C1, or our first cervical vertebrae, with these rounded processes right here. And these are the occipital condyles, the condyles of the occipital bone. Good luck studying. All right, everyone, let's look at an inferior view of the skull and see what structures we can see from here. First of all, we've got the top part of the mouth. We can see this maxillary bone and the palatine bones. And this big surface right here on the maxillary bone is the palatine process of the maxillary bone. Keep in mind that these are the palatine bones, and that form more of the softer palate in your mouth, and then the hard palate is the palatine process of that maxillary bone. Let's then move down and start looking at some of these big holes and big openings that we can see where blood vessels and nerves are going to run into and out of the skull. From the side, we can see that external acoustic meatus for our ear, And from that inferior view again, we can see a bunch of these holes. Let's start off with the easiest one. This large hole right here, that's our foramen magnum, sometimes called the magnum foramen. It's the big hole for our spinal cord. We can then, another structure that we can see are these rounded surfaces right next to the magnum foramen, and those are the occipital condyles. And if we slide just laterally to these occipital condyles, we see our first major foramen right there, and that is the jugular foramen. We've got a jugular foramen on this side and a jugular foramen on the other side as well. If we keep moving laterally, we can see this hole right here, and that is going to be the entrance to the carotid canal. And again, two of those on either side. So again, foramen magnum, occipital condyle, jugular foramen, first hole that we see. Next hole is the entrance to the carotid canal, right there. If we move up here, we can see a couple foramen on either side on more of the medial part of the skull. If we start right down this midline right here, we can see this first foramen that we run into is the foramen lacerum. The foramen lacerum. And lacerum means teardrop, and this foramen is kind of teardrop shaped. I don't know if you can see that, kind of triangular. It's got like an edge there, and a little rounded surface on the bottom. The foramen lacerum there, and the foramen lacerum there. Sliding out, the next major foramen that we can see is this oval-shaped one right here, and this oval-shaped foramen is the foramen ovale, the foramen ovale. So again, from the middle we would have that foramen lacerum, foramen ovale. And those are the major foramen that I would like us to know from this inferior view. Okay, let's look at this view right here. So what we've done here is we've taken the top part of the skull off, made a transverse cut here, and we're going to look at sort of a superior view looking down into this brain casing right here. Biggest structures that we can see immediately, we've got our foramen magnum right here. Remember, sliding right off of the foramen magnum, we can see this jugular foramen. Here's that temporal bone, and on the outside we would see the external acoustic meatus. And now we can see the internal acoustic meatus right there. And that's where our auditory nerves would exit and then enter into the brain there. Other foramen that we can see the foramen ovale right here, that oval-shaped foramen. And what's interesting now is we can see that foramen lacerum right here, the tear-shaped one, and it merges and forms a single canal with this carotid canal right there. And again, these are on the right and on the left side. And another cool part about this view is that we get to see some of the ethmoid bone right here and the sphenoid bone right here. And one thing I'd like to point out about the sphenoid bone is we get this little saddle-shaped kind of compartment right here, and this is called the sella turcica. And this sella turcica, this little saddle, is right where the pituitary gland would rest in. And then we've got this ethmoid bone right here, and it's hard to see in this video, but there's a little piece that sticks up right in the center, and that little piece that sticks up is the crista galli, and then the larger majority of the bone around and below that crista galli, that's the cribriform plate. Good luck with our studying. Okay, let's take a look at our cervical vertebrae. If you can see here, we have sort of our neck vertebrae that we can look at. We're looking at a posterior view here, and then I'm going to swing it around and look at the anterior view. And we have 1, 2, 3, 4, 5, 6, and 7 cervical vertebrae here. They're named C1, C2, C3, C4, C5, all the way down to C7. And these top two ones have their own special structures and their own special names. The very top, the C1 cervical vertebrae, This is our atlas. And then this green one down here would be our axis. And we can take a look at a couple of these two bones right here, and we'll see sort of how they articulate with one another and how C1 can rotate around C2 right there. And let's take a look at our cervical vertebrae and see if we can name all of the structures on our cervical vertebrae. First up, the main part, the largest part of our cervical vertebrae, and really all of our vertebrae, are the body of the vertebrae right there. We've got our vertebral foramen, this big hole right here, and then we have transverse processes on the side, and a big spinous process on the most posterior side. Connecting those different processes, we've got a couple of structures here. We've got the lamina, or the small part of the vertebrae that connects the spinous process with the transverse process, so it's kind of this area right here. And then we have another smaller area here called the pedicle, And what's cool about these cervical vertebrae is they have an additional hole. This hole right here, right by this transverse process, is the transverse foramen right there. The other cool part and the main structure that I'd like us to check out here is this little vertical process that fits beautifully right around C1, or our atlas, and there's a little bit of ligament that wraps around right here, and again it allows C1 to beautifully rotate right around C2. And this little silver process right here, this is called the dens. This is the dens of this bone right here, which is the axis, the dens of the axis. Okay, here we've got a thoracic vertebrae, and let's make sure that we know all of the structures on this thing right here. Again, where I like to start on this anterior surface, this large portion of the vertebrae, we've got our body of the vertebrae. We've got a hole right here, and then we've got our vertebral foramen. And then the huge processes that we can see here, we've got our spinous process on the posterior side, and then two transverse processes sort of coming out at an angle on either side. We can see these little facets right here, or these vertebral condyles that we're going to articulate with the next vertebrae. And then moving our way around, we can see a couple structures here. We can see we've got the lamina connecting the spinous process to the transverse process. And connecting our transverse process to our body, we can see the pedicle right there and the pedicle right here. Another structure that we can see, if I put the next vertebrae on, we can see these little holes right here, and this little hole is where our spinal nerves would exit out of the side, and these small holes right there are the intervertebral foramen, or where our spinal nerves can exit. I think that's just about it for the structures of our vertebrae. So here we have our articulated spinal cord, or our articulated vertebrae. We've got our occipital bone forming the bottom and back part of our skull, followed by our 7 cervical vertebrae from C1 to C7. Then we would transition into our thoracic vertebrae from T1 to T12. And then we've got our lumbar vertebrae down here from L1 to L5. So we have 7 cervical vertebrae, 12 thoracic vertebrae, and then 5 lumbar vertebrae. The way I remember this is we eat breakfast at 7, lunch at noon, and then dinner at 5. Down here we can see our os coxae, or our pelvic bones. And we can see at the very bottom here, we can see the sacrum, this big bone right here. It's 5 or so bones fused together. And then this smaller bone down here is the coccyx. Okay, last but not least, let's look at our rib cage, or our thoracic cage, to finish up our axial bones. We've got this huge breastbone right here, our sternum. We've got our ribs running around the outside of our thoracic cage. And then we've got costal cartilage that connects our ribs to our sternum. And so our sternum has a few bones that make it up. We've got the manubrium, the body, and then this small point down here is another xiphoid process. On this manubrium here, you can see the jugular notch forming right there. And then we can run down and we can look at all of our ribs. We've got rib 1, 2, 3, 4, 5, 6, and 7. And rib 7 through 1, these are all of our true ribs. Then we've got some false ribs working our way down from here. We've got false ribs being 8 and 9 and 10. And then we've got floating ribs, 11 and 12 in the back there. 12 ribs. The first 7 are our true ribs, 8, 9, and 10 being our false ribs. And then those bottom 2 that don't connect to the sternum at all are our floating ribs. And that, I think, finishes up our axial bones.